Hi everyone. Today we will discuss about most commonly asked question in the exam, and that is heparin versus warfarin. Most of the time students gets confused between these two drugs. After this video you will never forget about the differences between the heparin and warfarin. So let us begin. Heparin is a chemically mucopolysaccharide in nature, while warfarin is a coumarin derivative. Heparin is derived from the ox lung or pig intestine, while warfarin is a synthetic derivative. Heparin is given by IV or subcutaneous route, and warfarin is given by oral preparations. Heparin is having an immediate onset of action, while warfarin is having a delayed onset of action. Heparin has a duration of action of about 4 to 6 hours, while warfarin takes time to develop its effect and it is about 3 to 6 days. As heparin is having an immediate onset of action and it is given by intravenous or subcutaneous route, it can be used in emergency situations, while warfarin is having a delayed onset of action and it takes 3 to 6 days to develop its effect, and that is the reason it is used as a maintenance therapy in long term. Heparin acts in the blood and it activates antithrombin 3, which inhibits the factor 10A and factor 2A, that is thrombin. And heparin acts on already formed clotting factors, and that is the reason it acts immediately and it is having a fast onset of action. While warfarin, it acts in the liver, it inhibits the vitamin K epoxide reductase enzyme and it decreases the synthesis of clotting factors 2, 7, 9 and 10, and apart from this it also inhibits protein C and S synthesis. Warfarin prevents the synthesis of the new clotting factors, and that is the reason it takes time to develop its effect. Heparin is monitored by aPTT while warfarin is monitored by prothrombin time international normalized ratio. Now let us connect this with the coagulation pathway. Heparin mainly affects the intrinsic pathway coagulating factors, and that is the reason we monitor aPTT, and warfarin affects mainly extrinsic pathway, and that is the reason we monitor by PT time or international normalized ratio. Heparin is having a few drug interactions and they are not clinically significant. Warfarin is having a clinically significant drug interactions, and so we have to increase or decrease the dose of the warfarin based on the drug-drug interactions with the warfarin. Both heparin and warfarin can cause bleeding as a major side effect, and for this we have to give protamine sulfate in case of heparin, which is an antidote, and for warfarin antidote is vitamin K, or you can give fresh frozen plasma to prevent bleeding. Heparin is safe in pregnancy and you can easily administer during the pregnancy, while warfarin is contraindicated to use during the pregnancy and it can result in fetal contrary syndrome, which results in stippled epiphysis and intrauterine growth retardation of the fetus. The unique adverse effect of heparin is heparin-induced thrombocytopenia or HIT syndrome. Warfarin is having a unique adverse effect of skin necrosis, which results due to protein C synthesis inhibition, which results in hypercoagulation, and another is purple toe syndrome. Heparin is mainly used to initiate the therapy in case of deep vein thrombosis to prevent pulmonary embolism and in case of myocardial infarction during the surgery and dialysis. Warfarin is used mainly as a maintenance therapy in case of prosthetic heart valves, atrial fibrillation and deep vein thrombosis prophylaxis. So this was about the differences between the heparin and warfarin. To summarize this video, heparin is a faster acting, it is given by intravenous or subcutaneous route and it is used in an emergency situations. While warfarin is a slow acting drug which is used orally and it is used in the long term therapy. If you like this video about the differences between the heparin and warfarin, subscribe my channel and follow for more pharmacology related videos. Thank you.